Hello, happy Friday.
Hello.
How is everybody? I hope you can hear me. It looks like you can. We're here. I'm Dakota. This is Mayra.
Yes.
And we're going to do our regular Friday live stream.
Yes.
I feel like it's been a little while since I've done this. I'm a little out of it. Yeah, we've got a topic to talk about today. We're gonna go over WPCS. We're gonna give it a few minutes before we jump right into it. Just give people time to show up and whatever. But if you're here, leave us a comment, say hello, and we probably will have time to go over some other things if people have questions. So if you have questions about things that are not related to our topic, go ahead and leave them, and we might have time to get to them at the end.
Sounds good.
Is there anything going on? I think a few weeks ago we talked about we were planning a seminar, Southern California. Did we get any more details on that?
Yes.
Do we know where it's going to be?
I believe we have one coming up in Glendale. And right?
And Orange, we have 2 of them.
Yeah.
Right, that's right. We were going to do 2 of them in one weekend, I believe.
Yes.
Saturday and Sunday, is that right?
Saturday and Sunday.
Glendale, and where you said Orange County?
Orange County.
Okay, so if you're in Southern California and you wanted to go to one of our seminars, we got 2 of them for you. So look forward to that. I believe that's the end of April that those are happening.
Yes, that is right. And let me look.
25th
Yes.
and 26th. Do we have signups for that already, or did we set the dates?
Not yet. On Facebook first, once they're on our website.
Okay, well, there's all you need to know. I'll say it again in case you didn't hear it. So the 25th and 26th in Glendale and Orange County, we're doing our seminars in April, April 25th and 26th. And when the signups are open, they're going to go up on Facebook. So follow us on Facebook if you want to join us for that. I see we got a few people here already, so I think we can start in on our topic.
Sounds good.
WPCS. Now, I know you've been doing some research this week, and I've done some research in the past, but this is still, to us, and I think to a lot of people, a very mysterious program.
Yes.
Because there aren't a lot of people that are on it, right? I've probably met 1 or 2 people who have gotten the program. Have you talked to anyone who's actually been on WPCS?
I have talked only through my Facebook community as well, right? You guys, that you guys have actually mentioned this program, and I haven't personally worked with anybody with WPCS, but it made me curious because I feel like there's just so much to learn, and it is a very tricky program, and yeah, there's a lot of well, this is how you do it, and that's how you do it, and this is how you get it, and you can't get it, but it really isn't that easy. It's actually very, very hard to get.
It's similar to me when I first learned about IHSS, that when you read the laws surrounding, when you read the regulations, it sounds so simple. They say, oh, this is a program that exists to help with this, this, and this, and you have to submit this form, and then you're done. And they make it sound like it's such a simple and easy process. But then in the practicality, it's like, well, what do they actually do? And I can get into that. When it comes to what it actually does, it is similar in many ways to IHSS. It provides money for a provider to provide services. So let's jump into the basics. So WPCS, for one thing, it stands for Waiver Personal Care Services. And it does pretty much explain what it is. It's personal care. So similar to IHSS, it's for bathing and dressing and keeping a person healthy who can't do it themselves.
Okay.
And the waiver part has to do with how you qualify for it.
Okay.
And this is why so few people are on it, is that in order to get Waiver Personal Care Services, you have to be on which one is it? The HCBA waiver.
Now, what does that stand for?
Home and Community-Based Alternatives.
Okay.
Which is it's like a derivative of the Home and Community-Based Services waiver. I'm using my hands a lot today.
It's okay.
We have so many acronyms. I've made jokes before about how we could just talk entirely in acronyms in this job.
Oh yeah.
But the HCBA waiver, this is it's part of Medicaid, where when you're on Medicaid, you're on one waiver or another in order to get IHSS. This is part I don't even understand entirely. And a lot of people don't even know which of these waivers they're on. because it's not, doesn't really matter at all. When it comes to IHSS, it doesn't matter which waiver you're on.
Right.
You can get IHSS with either one. But there are very few of these HCBA waivers that are given out every year. It might even be only double digits.
Oh, wow.
Because it's just, there's so few people that are on this waiver. Teresa could probably find the exact numbers, but I think across the entire state, there's only like a few thousand people total who are on this waiver. And if you're not on the waiver, you can't get WPCS.
Question.
Yeah.
Okay. So how would you go, how would you find out what waiver you're on or what program you're on? How you said, like, there's a lot of people who don't know what they're on, right? So how would you go about knowing if you're on the waiver or not?
Well, this is part of Medi-Cal, Medicaid. So they would probably know. I would say if you contact them, or it might even be in some of the documentation you get, it might say which waiver you're on. But my guess is if you don't know, you're probably not on this one.
Got it. Right?
Because not only is it so few people, but when you apply for it, there is a very long waiting period. Now, there are different subsets of people that get put on the waiver faster. I believe the number one priority is people under the age of 21, which could apply to many people who are trying to get this waiver, who are on the wait list. After that, it's people who are leaving other Medi-Cal programs and getting put on this one. I don't quite understand what that means. I think that one's a little bit of an older issue. And then others is people who are currently residing in medical facilities, things like that, and they are trying to come back home. Then they get priority on the wait list. So the thing is, even with some people getting priority, it can take a very, very long time to finally get the waiver. Right. Chris asked, what's the waiver called? Well, the waiver to get WPCS is the HCBA, which stands for Home and Community-Based Alternatives. Now, in order to get that, you have to submit a form to I think we just said it was DHSS. DHSS, is that right? Okay, I think that's right.
Yeah, they have to submit it. Yeah, DHCS. Right? Yeah.
DHCS or DHSS? It's one or the other.
It's one of those.
Okay, the DHCS website is where you submit the application for the HCBA in order to get WPCS. Makes total sense, right?
It makes all the sense. It's
Of course. So
Department of Healthcare Services.
all right, so that's how you get it. That's how you get it in the simplest terms imaginable. So what happens? So when you apply, you get the waiver, you apply for WPCS, they will do an assessment similar to an IHSS assessment. I think this one's a little bit more of a medical assessment. So it might be a public health nurse rather than a social worker, or it might be a combination, who will assess the person's needs beyond what their IHSS can already provide. Sorry, this is another important thing. To get WPCS, you got to get IHSS first.
Right.
Now, this can be a little complicated. If you look it up, the information, it'll say you have to have IHSS. Technically, you can apply for WPCS without having IHSS. But if you do that, then step number one is that they're going to apply you for IHSS automatically. Essentially, they have to make sure that IHSS can't already cover whatever services you need before they then go and give you WPCS. Speaking of the services, a lot of the services that WPCS says it provides, and this is why it's so confusing.
Yes.
A lot of the services overlap with IHSS. It's the same stuff. It says things like toileting and feeding and dressing and other activities of daily living. And you might say,
well, that
IHSS does that stuff,
IHSS.
right? It's the exact same thing. And yes, that's why a lot of people don't necessarily need WPCS for all that personal care stuff. Is that if IHSS providing you 5 hours a week for dressing or bowel and bladder care, then under most circumstances that will cover it. But if you have just a really intense level of like nursing level care need at home,
Right.
then there could be need for even more. And so
Sorry, I was reading
I saw hello, is
Yeah.
that Mayra?
Yes, it is.
Yes,
Hi.
it is. Yes, it is. She's joining us today.
I know.
Um,
So what aside from the fact that there is certain ADLs, right, that WPCS would, well, you say that it's IHSS, but WPCS does cover.
Mhm.
What would you say is one of the things that makes WPCS different? Like what services that aren't included in IHSS would be included with WPCS?
I'd say there are two main things.
Okay.
So aside from all the things PCS can do that's sort of over and above, the two main big different ones is, one, they can provide some services while the person is like in a hospital.
Okay.
So if they are in a nursing facility or they're in the hospital for several days, things like that, WPCS will provide a little bit of like home care work while the person is in the hospital, which IHSS will not do. IHSS says if you are being cared for in a home, in the hospital, in any sort of like Medi-Cal paid for situation, then IHSS is just completely cut off.
Right.
But WPCS does provide for some shopping, some grocery work, some cleanup of the house, picking up prescriptions, all of this stuff in order to prepare for the person coming back home.
Nice.
So there is that, but that's sort of temporary. It's maybe a smaller amount.
Right.
But the other thing that WPCS provides that is completely unique to that program is adult companionship and socialization. So providing for a person to either go to community activities or have someone come to the home who will spend time with them and really meet those social mental needs is something that WPCS covers that IHSS really does not cover at all.
Okay.
Now, I have heard also of people getting not necessarily protective supervision, but maybe a level of medical supervision that is way over and above what IHSS can provide. So I met one person who, I'm not going to say too many personal details, but her son had very serious medical conditions and needed constant round-the-clock like nursing level care even while asleep.
Oh, wow.
And so IHSS protective supervision only covers 9 hours a day.
Right. And
the whole, even the maximum 283 only covers, I think, close to 12 hours, I think. The WPCS provided for a nurse to stay at the bedside throughout the entire night.
Oh, wow.
So 24 hours, I think, between her IHSS and WPCS combined, she had something like 450 hours, something like that.
Oh, wow.
Which is huge, right?
Right.
Way above what just IHSS can provide. Oh no, what have I done? Sorry, I got rid of our stream. I'm gonna pull it back
We're still
up.
here, but
I saw a few comments, so let's get to those.
Okay,
and you can let me know if you have any questions also.
good.
Okay. Marcella, I think Teresa answered this, but let me just check. My daughter has Down syndrome, right? How or where am I to find someone who can help me with a living trust? And I think, Teresa, you did put an answer in the comment section. So
great.
She's on top of it. Moses said, so how many hours can you get from IHS and WPCS? What's the max?
That's a good question.
Yeah, as far as I'm aware, there isn't technically a maximum. IHS still has its maximum of 283, but WPCS is pretty much just whatever you medically need above what IHS can provide, then that's it.
So case by case basis.
It's on a case by case basis. Now, one thing to keep in mind is that even if you have IHSS and WPCS, the maximum hours that one provider can provide doesn't change.
Okay.
So a single provider can still only do 283 hours a month.
Mm-hmm.
So if you were over and above that, then you might need a second or a third provider to do all that work. Like the example I gave of the mother who had max hours IHSS, protective supervision, and also had to hire a nurse to do all that middle of the night stuff. She herself can still only get to the 283 max,
Okay.
or 360 if you have the exception.
That's good to know.
Let me see here. Thank you for hosting live YouTube with great topics. Thank you. Appreciate it.
Yes, thank you for joining us.
There's a Teresa just added this little context. There's a bill that's going through the state legislation to double the number of HCBA waivers by 2027. The bills aim to move beyond the current 5,000. Okay, so that's what it is. 5,000 waivers is the. Let me put this up on the screen.
5,000 waivers.
So that is how many people can have the HCBA waiver, which is necessary in order to get WPCS. So that's why so few people get it, is that it is more than 30,000 IHSS recipients. It is so few people.
Oh, yeah.
Right, that are getting this waiver on top of that.
Oh, yeah, definitely.
So all that information is that they're proposing to increase to 10,000 so that a lot more people can get on that.
Oh, that would be great.
I think I kind of already answered this, but I'll just say it again. What if you already get max IHSS? Yeah, you can still get WPCS on top of that, but like I said, as a provider, you cannot go over the provider maximum. You'd have to get a second person.
Or third. Be glitching.
Okay, we might our tech might be a little bit slow right now. Oh, there it is. Alyssa said, "When is an adoption Q&A?" That sounds like someone who really wants us to do a live on adoption assistance or something along those lines soon. So we will keep that in mind, and we'll put that on as soon as we can. All right, there's the answer for Marcella that you put out. The question you asked earlier, there's your answer. Who we would recommend looking at.
That's great.
Lady Trina said, maybe off topic, but do you offer therapy or have recommendations for teens, young adults on the spectrum? Therapy isn't really something that we do. I mean, our advocates are all really good at hearing you. You know, when you're our client, we talk with you, we get to know you really well, and that can be in some ways cathartic. But we're not therapists by any means,
right?
And as for recommendations, I think it really depends on where you are. You know. Teresa's on top of it. She's got answers for all of you.
Answers, yes.
There
you go.
Danette.
Yeah, Danette.
Have you heard of any future resources to help clients find providers easier on WPCS? My daughter has IHSS. I'm the main provider. WPCS is additional care, like that's like I was talking about before. I live in the Central Valley. Even though IHSS has providers lists available to clients to interview from, it's still very slim to find dedicated providers. Family still has to interview on their own to find the provider. Regional center will not give you a list to make recommendations. I don't believe there is a WPCS list, although I will say I believe the rules and regulations and the process to become a WPCS provider is basically identical to IHSS.
Provider?
Yeah, I believe the process to become a provider is pretty much the same. And I think if you are an IHSS provider, you might already be qualified to do a WPCS, depending on the case, right? Like we're talking about case-by-case basis. Some people might need an actual nurse with actual qualifications to do their work. Unfortunately, IHSS itself is already hard enough to find a reliable provider, as you mentioned. And I think the legislature is considering actually just getting rid of the provider list, the provider registry, because it's just not working. It's just people aren't getting aren't able to find providers. Most people want to have it be a family member anyway. So not only I think there isn't a list or a way to find providers, I think it's probably going to get harder. But if you have some people that are able to do IHSS, they probably either already are able to or can very quickly and easily become able to do WPCS.
Yeah. It's good to know. And again, sorry if I'm being very quiet. I am learning just as much as you guys are learning. So I am absorbing everything and taking it all in.
Yeah, and I mean, this is what we were talking about at the very beginning. It is so hard to find information about this program because so few people have it. Like we said, 5,000 in the whole state. At maximum, 5,000 people have it.
Yeah.
And not everyone's got the same, extent of need. They might, some people might only get 10 hours on WPCS, and you don't really know for sure what all it provides.
That is a good question.
Sherry said, can hours overlap if recipient requires two people to assist them
At a time?
That's very interesting. I don't think I've heard information on that.
Me neither.
My gut reaction would say no, but I mean, that could be maybe an argument for when WPCS provides, because it provides for what IHSS cannot, when the need is over and above what IHSS can do. And so if there is a need for two providers to work one task together in order to assist a person, that could be, like, my gut reaction would say no, but that's me coming from IHSS, where on IHSS it would be, oh, absolutely not. But
with WPCS,
the rules are different, so it really could be. Ernie, it's not up there. It is. How do you apply for WPCS? So we went over this a little bit at the beginning, but you have to have the
HCBA.
You got it. HCBA waiver, and you get that by sending an application to DHCS,
the Department of Healthcare Services,
on their website. Yes. And I think if and when you get the waiver, it should be relatively easy to apply for WPCS. Not saying that you're going to get it necessarily. We had someone last week or a few weeks ago who they got the waiver and then didn't get any services from WPCS, which I was surprised by that, because I thought getting the waiver was the hard part, but apparently, getting the services can be difficult as well.
Okay.
My daughter has Medi-Cal as a secondary insurance. Her primary insurance is my employer insurance. So if she goes to the hospital, because for the hospital, my employer insurance can I still get paid? Under IHSS, I don't think so. I think even if it's your other insurance that's covering the stay, I don't think Medi-Cal will pay, because you still aren't doing the in-home. I'm assuming this is about IHSS. I'm pretty sure the in-home portion is still not being met. She is being cared for by a doctor, by nurses who are doing the care. So because someone is being paid, they're not going to pay you.
Yeah.
Even if it's not Medi-Cal.
It says while she's in the hospital, if Medi-Cal is
right. I got that. Like I said, under WPCS, there are a few things that they will pay for while the person's in the hospital, but IHSS will not.
Right.
Yeah. Teresa answered the question about where to find a therapist. He said, I have so many questions only Mayra can answer. I think she means the other Mayra. The other Mayra.
Like, oh, really?
The adoption questions, right? She's the person who knows so much about adoption. Marcella said thank you. So thank you, Teresa, for the answer. Julie, is it true that you have to have been granted IHSS for a certain amount of time before you can apply for WPCS? I've heard a lot of conflicting info on it. We don't have IHSS yet, still on a long wait list for an evaluation, so wasn't sure. So technically you don't have to. So this is what I was saying before is if you apply for WPCS first, they will automatically apply you for IHSS, and they'll kind of do the evaluations together. They'll evaluate for you for IHSS, give you whatever you need to get, and then see if there's anything that IHSS isn't covering that WPCS will provide. Now, the deal with this is that, so there's a thing in here where it talks about you have to be utilizing the maximum of your IHSS hours
Mhm.
to get WPCS. So to some extent, that might mean that you need to spend a little bit of time, but it shouldn't be much, because essentially what that means is if you're approved for IHSS but you're not using it, then they're not going to give you WPCS,
Okay.
right? Because WPCS is for what's over and above what your IHSS can provide. So if you have 200 hours of IHSS, but you're only using 150 hours, and then you apply for WPCS, they're saying, well, they'll say, you have to use your whole 200 hours before we can give you anything additional.
Okay.
Now, to my knowledge, this doesn't necessarily mean that you have to be getting the 283 from IHSS. Technically, I believe if you're receiving any number of hours under IHSS and you're using all of them, and there are still needs that IHSS doesn't cover that you can get through WPCS, then you can apply for WPCS. But if there are any things that overlap, then IHSS has to provide it first. So it's a complicated thing, and in some ways they might say, well, you should try getting it through IHSS first, make sure that doesn't cover it before you go to WPCS.
Okay.
And so that's where it gets that there may be a little bit of complicating factor there. Danette said, yes, thanks. Teresa said to the statement that Mayra has all the answers.
Oh.
Yes, we all agree.
Yes, definitely. She is not.
So
I have a question.
all right.
All right, Dakota.
There's some more information here. If you guys have some more questions, if you want to look up some of this information yourself, you can check it here. I just have to point out DHCS FAQs on HCBA and WPCS is just the most awful, sentence ever.
Sorry.
Oh, great.
Oh my goodness. All right. So what's your question?
Question. So have you heard of any social worker, right, when they go and do the assessment for IHSS? Have you heard of any social workers kind of recommending, like, hey, you know what, I believe you qualify for WPCS? Have you ever heard of the social worker actually helping the family try and get into WPCS? Or just a question, just wanted to know.
Yes. I think I've heard of this a couple of times.
Okay.
There was one time I think that happened with one of my clients, and another time I think I heard it from Caleb or someone else here, where the social worker essentially told them, hey, you've gotten everything you can get from IHSS, but there's this other program called WPCS that you should be able to qualify for. You should apply.
Okay.
I've had that said to a couple of people. Now, I think the social worker did sort of direct them on where to go with that, said, oh, you got to call this number or send in this form to this place.
Great.
But they didn't, as far as I know, they didn't have any power to fast track them onto the program or to get them the waiver or anything like that. Because there are still two separate programs, even though they're very much interconnected. Sherry said she was referred to WPCS by her social worker. Yeah, so it definitely does happen. I've seen it a few times. It's not required in order to get the program, but I have seen it. I don't know, Sherry, did it seem like yours went especially, if you don't mind saying, did it seem like yours went especially quickly? Because as far as I know, I don't think social workers have any sway or power to make it happen faster, but I could be wrong. And maybe that's something you could talk to your social worker about, if that is a thing that they do.
Did you think that people in the hospital that are transferring home, they have more power
to getting them?
Yes,
the
there
WPCS?
is.
Okay.
There is one of the aspects of priority. One of the things that can get you fast tracked on getting the waiver is leaving a care facility in order to go home. But even then, it's a lot of people. It's only 5,000 people in the whole state that can get the waiver. So it's so Darlene, I'll answer your question real quick. It stands for Waiver Personal Care Services, and the shortest way I can explain it is services similar to IHSS that are over and above the personal care services that are over and above what IHSS can provide, as well as some time for adult socialization and companionship for those who are over 18.
Yes.
Yeah. And Sherry said, yes, the social worker just gave them a phone number to call.
Oh, great.
They couldn't do anything to fast track the process, but yeah,
It was a phone number to call.
So that's the thing. It's a very cool program. There's some cool things about it, and we love to share about it. But there are so few people that are on it, and there's so few people that can get on it.
Yeah.
So, for one thing, there are a couple more things.
She did say.
I just didn't provide
agency connection
or expedite services. Okay, that's kind of what I expected.
Right.
And then Jill said, I'm joining late. My son receives 283 hours IHS, but he has extreme needs. He can possibly qualify. Yes, that is a very good example of someone. Now, I don't believe you, like I was saying, I don't think you technically need 283 in order to apply for WPCS, but if you are at the maximum and there are still needs, then that is probably a good example of someone who, you know, if it's deemed by a medical professional and you get the waiver, then that's, I would think, a good example of someone who could get WPCS.
Essentially, yes.
And yeah, we'd like to share about this, but it is so difficult because so few people have it and so few people can get on it that it's hard to see the results of like what works, what doesn't work, what's the best practices, what's a typical assessment look like. We've not been to any WPCS assessments because they're so rare. And so it's really hard to give concrete information, which is why we really appreciate people who have been on the program or have been recommended to share it with us, because we've heard so few personal stories about what this program has provided for them. Samar said, hi, I'm currently taking care of my mom and my son. My son is 241 hours and my mom has 128 hours. Would I qualify for this? It's really impossible to say.
Yeah.
One thing is that, I mean, with that many hours already, you as one provider wouldn't be able to provide all that time. So you'd already need a second. You would already need a second provider to work all those IHSS hours. Now, you would only qualify for WPCS if it has services that it offers that are not already being covered by IHSS and can't be covered by IHSS, right? So if you're, let's say, maxed out on the time that you can get for hygiene, like your son, 241 hours, they're giving you the maximum hygiene time for IHSS, and it's still not enough. You still have to have someone to come in and do additional services in that category throughout the day. I don't have a good example, but somehow that's not covering it, and I just cannot give you any more. That's when WPCS would come in.
Okay.
Or you did mention your mom, 128 hours. WPCS might work for her because they offer that adult companionship socialization aspect that IHSS doesn't cover. So if there's a need for that, for her to get transportation to go to community events, to be out with other people, or to receive, time with I don't know who does
any
that.
sort of
any sort of like
outdoor,
almost like respite
community.
type of work.
Just out
then
in the community.
That might be something else that WPCS would fill in, even though she's not way up at the maximum of IHSS. That is a service that IHSS doesn't provide, and so if it's deemed necessary, then that program could be for her. Yeah,
that makes sense.
It's hard for me to give concrete information because we've seen so few people on the program, and so we don't know necessarily exactly the right answers.
Mm.
Jill said, should I contact North Bay Regional Center about this? I would say you can definitely try.
You can ask.
Um,
Yeah.
They're not always the most helpful when it comes to IHSS
Mm-hmm.
and I would I think by extension WPCS as far as like helping you get the program. I mean, there are certain things they can provide documents and information, but they're not always so great about like helping you fill out the documents for those
Right.
programs. So you can try. I don't know if they have.
It wouldn't hurt, but we don't know that outcome.
I provide all my son's care and I have no socialization. I should clarify. What I mean is the recipient.
For them.
Right. It's that if you need time for the companionship and the socialization of the recipient. Now, if your son's an adult, then yes, that would still fit. But it's not like respite in that sense. It's for the person, the person with the disability to receive companionship and socialization and community activities, that kind of thing.
For their mental health, right?
Yes,
Like,
to kind of preserve their mental health, their quality of life,
yes.
and yeah, that kind of a thing.
Yes.
If you need time for socialization, that's when I would say talk to Regional Center for Respite, because that's what that's all about. Okay, I think we're not necessarily out of time, but I think we've pretty much covered everything. There are a lot of great comments. If there's anything, there's no one. We'll just keep wrapping up until we stop getting comments, and that's what we'll do. It's all right. I love answering these questions. My son gets paramedical through IHSS. I applied WPCS. He's turning 4 next month. I just claims he's self-directed but denied him protective supervision. Can my son get some hours for it? So I don't think WPCS will approve protective supervision if IHSS has denied it.
Right.
Because that's one of those things where it's like a service needs to be provided by IHSS first for WPCS to then fill in for the over and above, right? So I don't think you'll get protective supervision through WPCS, but you can get like vast amounts of paramedical hours that might be over and above what IHSS is willing to provide, right? So if they're saying, well, paramedical through IHSS will only provide for the hands-on work, that's how paramedical works in IHSS. It's like only while you're actively injecting the thing or putting in the administering the medication or cleaning the device and things like that. They'll say only while you're actively working on it will we provide paramedical. WPCS might be a little bit more medical supervision focused in some areas. So if he has a significant amount of paramedical needs, that might be a little bit different from what IHSS is willing to provide. More, overnight supervision, checking on him to make sure that he's breathing and or whatever else. I'm, completely making things up here, but then WPCS might cover some of that stuff. Yeah,
that sounds accurate.
I was told WPCS does not cover behavioral, just nursing related tasks. Yes, behavioral in the sense of like protective supervision that they won't cover for someone who is actively putting themselves in danger, throughout the day. That's what IHSS protective supervision is for. But someone who has a medical condition who is in danger, that's where the WPCS comes in. But again, like we mentioned, the socialization, adult companionship, that is covered, even though it's not necessarily I wouldn't call it a nursing type task, but I guess it counts in some way.
Because it does help, again, with their quality of life, right? For them to be okay. He gets croup a lot.
Oh, okay.
It's like the cough, right? Like the...
Yeah. Dr. with recurring. Yeah, I don't know enough to say for sure whether that would, whether you get the WPCS for that.
Yeah.
it's the kind of thing that when it comes to the waiver and WPCS, it's such a difficult thing to get. I really can just say it can't hurt to try, and the chances you'll actually get on it are so low, and it'll take such a long time. Like, it could be, if you do get the waiver, it could be 2 years from now, right? And PIKE as well. That's okay. So that's the thing. If you I'll put this on the screen so people know what we're talking about.
Yeah.
When you get PICA, because the croup is one thing. If it's a coughing medical thing, PICA is different. When you get PICA, really, PICA should be a protective supervision type behavior.
Yeah.
Because typically, historically, PICA has been considered a non-self-directed, a self-injurious type of behavior in which IHSS should come in and provide protective supervision. But they're really difficult. I mean, you said he's almost 3 years old. They look at that and they say, oh, well, every kid puts stuff in their mouth at 3 years old. But no, if he's diagnosed with PICA, I would push much harder for protective supervision rather than going after WPCS. Because I think you're much more likely to get protective supervision than WPCS, and you'll probably get more hours out of that than the other one. All these long words. Does WPCS have a direct site to contact? I don't think so. I think you have to go through the DHCA.
Yes, DHCS. Department of Health Care Services.
DHCS.
Yes.
DHCS is the department to contact. You use their website. I don't think WPCS has its own.
Right.
Okay. Now we've gotten through all the comments again. I'll give just one more minute in case someone has a last minute thing they were saving for the end. But if not, do keep in mind we still have our seminars end of April, 25th. The 25th and the 26th.
26th is in Glendale.
Oh,
yes.
Okay. Orange County's first.
Yes.
Orange County on the 25th of April and Glendale on the 26th of April.
Mm-hmm.
All right. So
will you be there?
Maybe. I might be. We'll figure it out. So thank you all for coming. Hope this was helpful and informational. If you have more comments, let us know, and we will try and answer them after the fact if we get more information. But yeah, thank you, Mayra, for being here.
Thank you for having me sit in. And again, this is just as I'm learning as well as you guys are learning. And so just thank you so much for letting me sit here and kind of just, bombard you and ask you with questions of my own. So.
Absolutely.
And thank you for having me.
She will be going live in Spanish in just a few minutes here,
yes.
where she's going to be giving out basically the exact same information. So if you missed anything, you can watch that one in Spanish and
definitely,
catch up on the things that you missed. But until then, we'll see you guys next time. Is it Q&A next week?
Yes.
Q&A next week. So look forward to it. All right.
Bye. Happy